We're here at Ridgeview Medical Center in Waconia to learn about the services they provide to the community. Joining me now is Kevin Sipprell, EMS Medical Director and ER Doctor for Ridgeview Medical Center. Thanks for coming, Kevin.
Oh, it's my pleasure. I'm happy to be here. Thanks for asking.
Can you tell me a little bit about how you became the EMS Medical Director and an ER Doctor for Ridgeview?
I guess it started probably 24 years ago. One of my good friends said, hey, you should join the fire department. So I became a member of the Mound Fire Department. I did that for about 20 years, and during that time, I was actually doing medical research at the time I started and decided I needed to further my education. I got into medical school. So I went through medical school, residency, and actually started working here while I was a member of the Mound Fire Department.
Can you tell me what an EMS Medical Director does?
Sure. EMS is a little unique versus other emergency service organizations like police and fire in that EMS kind of has two bosses. Maybe one and a half. We have our director, which in our case is Daryl Roddy, and he's really the boss of the department. Controls the budget and all the human resources kinds of things, really does run the department. And then there is the supervisor or someone who oversees the medical care that's provided, and that's what an EMS medical director does. So it has to be a doctor with a medical license that oversees the protocols that paramedics use to care for patients. We do quality assurance, a lot of education. We do monthly run reviews with the paramedics. We review challenging runs with good learning opportunities, so that the whole department can learn from these challenging runs, the great runs, the not so great runs. And we also do, twice yearly, we do skills reviews. So all that education kind of falls under the medical director's realm.
Can you give me a sample of a protocol that an ambulance or one of the entities that you oversee might have that you make a decision on? Probably
one of the most common ones we use, and potentially one of the most critical, is a chest pain protocol, or any symptoms that we think might be related to having a heart attack or cardiac related. And so that would involve basically making an assessment, checking some vital signs, administering some oxygen, doing an EKG, so we get a rhythm strip or a picture of the electrical activity of that heart to determine whether or not this is a heart attack, and then treat their symptoms. Usually start with aspirin, and then some pain relief with a medicine called nitroglycerin, and perhaps even some morphine for pain. So that would be one example of kind of going through the process of going through a protocol, which is how paramedics basically care for patients.
So if I was in one of the cities that Ridgeview Medical Center or the ambulance responds to, and I call 911, what can I expect to happen after I make that 911 call?
Yeah, that's a great question, because it highlights something called a tiered response system that we have in this area. And what that means is the call starts with a 911 dispatcher, which, depending on where you are, tends to be with a county, either Carver County, Hennepin County. And if the call seems critical enough that they think they might need some instructions to the patient or patient family member prior to anyone's arrival, they transfer it to our dispatch center, where our dispatchers are trained to go through a system of asking particular questions and giving some instructions. Maybe it's relieving an airway obstruction or providing CPR, those kinds of things. So that's where it starts. The next step would be usually law enforcement, so sheriff's deputy, local police departments, and depending on the nature of the call, then it might be followed by first responders from fire department. And those first responders, both police and fire, are so critical to our system in getting care to people that need it quickly. We just can't have an ambulance on every street corner, and so we rely on our first responders for filling that gap and providing that potentially life-saving care when it's needed. So then the next step is an ambulance, and then obviously when the paramedics or EMTs show up, they kind of assume the care, usually with continued assistance from those first responders. Sometimes they even assist in riding in the back of the ambulance to assist with that care to the hospital, which is really, really important.
Thank you. So tell me a little bit about your public education programs that you have in place, that the hospital has put in place.
Yeah, so we have quite a few. There are a lot of education that we provide to first responders in terms of their protocols and their care. But the other one that's really important is cardiac arrest management and CPR. And one of the things that we've been trying to do is get as many people to learn compression-only or hands-only CPR, just as many people as absolutely possible to learn that vital life-saving technique. Cardiac arrest is probably the most critical life-threatening situation that a patient can be in. I mean, really, if we do nothing, they'll die. But it's also one of those situations that there's a lot we can provide to improve their chance of survival. And it really starts with CPR as quickly as possible, and hopefully with a bystander.
How long does it take someone to learn CPR?
Yeah, that's a good question, because if you take a formal class, it can take hours. And I highly recommend that as many people as possible take a formal class in CPR. There's more to it than just pushing on the chest, but just pushing on the chest can actually save a life. And it doesn't have to be done perfectly. Doing something will help rather than doing nothing. So, in light of that, I could teach someone to do CPR in about 1 minute if I was asked to.
Could you teach our viewers in 1 minute to do CPR?
I would be happy to.
Well, let's go.
Doing compression-only CPR is really easy. In fact, we can teach anyone compression-only CPR in a matter of minutes. What they need to do is, if they see an adult suddenly collapse, the first thing to do is call 911. Get help on the way. Send someone to find an AED if you're in a public place where there might be one. Next, put your hands on the center of the chest, put the other hand on top, and push hard and fast until help arrives. You want to push at a rate of about 100 compressions a minute. So you can see how easy it is to perform compression-only CPR. You don't need a mannequin to practice this. You could use a pillow or just practice right on the floor. But it's very simple, and if you want to see more or learn more, there are plenty of videos on the internet, including one on our website.
Kevin, thanks for showing our viewers hands-on only CPR. Can you tell us a little bit about your experience in the field?
Yeah, cardiac arrest is a great segue to that, because that is one of the conditions that I actually, if possible, I do respond to. There's still a fair amount of stuff that I do in the field responding to emergencies. Mass casualty incidents, for example. Patients who are trapped, they're actually very critical patients, and become more critical actually when they're removed from an entrapment. And that's the kind of situation that a doctor would respond to. So I do a fair amount of response still. I do miss the fire service, but I still get my scene response fixed by being a medical director and responding to things.
Yes, it has been 4 years since you were on the Mountain Fire Department.
Yes.
Kevin, so if someone wants to know more about Ridgeview Medical Center, how do they find information out?
Yeah, there are a lot of links on our website, so just visit the Ridgeview Medical Center website, and there's plenty of information and links on that.
Well, thank you very much for taking time out of your busy day to join us. We really do appreciate it.
Well, thanks for having me. I appreciate it.
First Responder TV will be right back.